Hi, my name is Dr. Scott Saint-Amour with RBK Pediatrics, and we wanted to announce to everybody that we're starting to get the COVID antibody test into the office. So I wanted to take a minute just to talk with you guys about it and how we're setting everything up and how we're making it available to everybody. The first thing that I think is important to mention, though, is that we're one of the only pediatric practices on Long Island that stayed open through the entire COVID pandemic. And we've done that because we believe we have a moral and ethical responsibility to provide our services to any of the children who need it, especially in times like this. So it's that attitude and that set of ethics which led us to devise a different system for testing all of our patients, one where we don't have to put the kids at any sort of risk to come in and get the test done. The testing kit that we're getting is from the Meridian Labs, and it's done by finger stick, so no blood draws, no needles, nothing like that. And with our goal in mind of not exposing the kids to any potential illnesses in the office, we're doing this in a way that I've started to call a drive-by finger stick. So we're dividing the appointment up in half. The first half is gathering the information. We're going to talk on telemedicine, through the computer, through the phone, and get an idea for if anybody's had any symptoms or come into contact with anybody with symptoms. And based on the answers to those questions, we can divide up our patients and have them come to the office at different times to avoid mixing the groups. The way we're doing the actual finger pricks is drive-by method. You can drive up in your car, you'll call us from the parking lot, and since we've already finished all of the talking, the nurse will come right out, we'll prick the finger, and we can run the test here in our lab, and we'll call you when we get the results in. We're expecting the test kits in this coming week. Give us a call, we can set everything up, and we'll give you a call when we have the appointments. The test is looking for antibodies, and it will be able to tell us whether you have an active infection at the moment, or whether anybody has been infected in the past and has the antibodies present. If you have any additional questions about any of this, feel free to call us. We're always here, we're always around, and we're more than happy to answer your questions. Thank you.